everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous sessions, as we have discussed about the various types of tube feeding, then we've also discussed about the gastric lavage, right? In this session, we are going to discuss about the input and output record. So here, just as we, help the client to take the adequate amount of nutrients as well as the medications, even if he or she is not able to do it because of his disease condition. In the same manner, for those patients, it is very important that we also monitor their intake and output chart, because here by monitoring their intake and output, it will give us an idea of the progression of the disease as well as whether the treatment which was provided to them is beneficial or not. So we must not only monitor, but here we must also record, right? So here in this session, we are going to discuss in detail about the input and output record, where we will come to know the importance, the purpose, the physiological basis, as well as the indication for the intake and output chart. So now let us start with this topic. Moving on to the first, which is the definition. Intake and output record is a record which will include the measurements of the patient intake through the mouth, through the tube feeding, or even through the intravenous catheter. And it also includes the measurement of the output of the patient from the kidney, gastrointestinal tract, drainage tube, as well as from the wound for 24 hours. So this intake and output record is a record which will include the intake and the output of the patient, right? So here it will include the measurement of all the fluid which the patient had taken, either through, the feeding tubes, because here some patient may not be able to take it orally because of their disease condition. So here the amount of fluid which they take through the feeding tube, through the mouth, or even through the intravenous catheter must be recorded, as well as the output of the patient from the kidney, the gastrointestinal tract, the wound, as well as from the drainage tube. And this must be maintained for an accurate 24 hours. And why do we record this? We do it because recording is an essential part of the patient assessment. So here, since I've said that this is a record which will contain the input and the output of the patient, right? So why is this important? Monitoring the intake and the output of the patient is an important clinical care process that will provide the means to determine the progress of the disease as well as the beneficial detrimental effect of treatment. So here, as I've previously said, that this is mainly done in order to get an idea of the progression of the disease as well as how beneficial the treatment is for that particular patient. So this is one of the main reasons why we monitor the intake and the output record of a person. By monitoring the intake, it also helps the caregiver to ensure that the particular patient has intake the adequate amount of fluid and nutrients. And by monitoring the output, it will help to determine whether there is adequate output of urine as well as normal defecation. So this is very simple, right? Why do we monitor the intake? We do it in order to get a detailed idea whether the patient is consuming the adequate amount of fluid and the nutrients or not. And we also monitor the output in order to get an idea whether the amount of fluid which a patient consumes is also equal to the amount of the urine or defecation which he is excreting. So now let us move on to the purpose of the intake and output chart. The intake and output chart is a tool which is used for documenting as well as sharing information about the amount of fluid which the patient had consumed, and this can either be through orally, through the gastrointestinal tract, that is through entry, or even through the intravenous route, that is through parenterally. So here the amount of fluid which the patient had consumed will be recorded, right? And this will not only include the fluid which he had consumed orally, but if he is under any tube feeding, then the amount of fluid which he consumes through this will also be noted, as well as if there is any intravenous fluid which is given to the patient, this will also be included. And also to get an idea of the excretion or the removal of the fluid from the patient. So this intake and output chart is also known as a fluid balance chart, because here it is very important, right, that the amount of fluid which which one consumes must also be equal to the amount of fluid which one excretes. So here, through this intake and output chart, we will be getting an idea of it. That is why this chart is also known as a fluid balance chart. And also in this, the amount will be measured in standard measuring unit, that is in milliliters, right? And also it is here that the amount is measured in standard measuring unit, that is in millimeters, right? So here some calculations can be done, such as addition, subtraction, or even totaling. That is why this is also known as the fluid balance chart. So this is the purpose of the intake and output chart. Now let us move on to the next, that is the physiological basis for the intake and output chart. This chart not only provides an information of the intake and output of the patient, but indirectly this chart also provides an information of the patient's physiology, which include the gastrointestinal function. That is, through this we will be getting an idea if the patient is able to eat or drink or not, the ability to absorb the food as well as defecation. And the second is the fluid balance and renal function. So through this we will be getting an idea whether the patient is able to pass urine in adequate amount or not. We will also be getting an idea if there is any occurrence of abnormal loss as well as about their bowel movement. So here, since I've said that this chart is not only maintained in order to get an idea of the intake and output of a patient, but here it also helps us to get an idea of the patient's physiology, right? So here, since I've also said that through this we will be getting an idea of the fluid balance as well as the renal function, right? Since I've said here that through this we will be getting an idea whether the patient is able to excrete urine in the adequate amount or not, right? Here it is very important for us to know the amount of fluid which is required by a person, as well as the output will vary depending on the age, the activity, as well as the physical surroundings. So here it is not necessary that each and every individual must require the same amount of fluid to consume as well as to excrete, but here depending on the age, depending on the activity, as well as depending on the physical surrounding, the amount of fluid which one need to consume as well as the urine output may be different. Here it is also very important for us to know here, as we also know that each and every individual must consume as much fluid as he can. That is why it is always advised that one must drink water as much as possible, right? Here actually for an adult person who weighs 50 to 90 kg is expected to consume fluid about 2,500 to 3,000 milliliter per day. So as it has always been advised that each and every individual must consume large amount of fluid, right? You might have heard it from your parents as well, that they may say you must always drink a lot of water. So why is this done? This is done in order to prevent dehydration, right? So here not only dehydration, but by drinking large amount of water, it also helps to prevent from the occurrence of many diseases. Here, for example, if we take an adult person who weighs around 50 to 90 kg, then here for them it is advisable that they must consume fluid of at least 2,500 to 3,000 ml per day, or even 2 ml per kg per day. So when you hear this, you might think that it is impossible for him, right? However, this can be achieved by consuming water as drink, by consuming water which will be a part of a solid food, as well as through the water which will be produced in the body as a product of metabolism. So here when I say this, it does not mean that it is only for those people who are under this weight, but here even for us, depending on our weight, the amount of fluid which we require will also be different. So depending on that, we must make sure that we consume adequate amount of fluid daily, and we can do it by following this method, that is by drinking water after each and every hour. So here, by adopting various methods such as these, we can still fulfill the amount of fluid which we must consume. And as we also know that the greater part of the fluid or of the water which we consume will be excreted through urine, the amount of which can be measured by various means. So here the normal urine output of an adult is between 1000 to 1500 ml per day. So by measuring the amount of urine which the person is excreting per day, we will be getting an idea whether the intake and the output is balanced or not. However, this is not the only way of excretion. This output of water can also occur through evaporation of water from the skin, from the mucous membrane, that is from the mouth, the throat, as well as through the respiratory tract, and also through sweating. So here the amount contributed by these two mechanisms, that is through sweating or even through the evaporation of water through the skin and mucous membrane, is about 800 to 1200 milliliter depending on the climate and environment. But still in clinical practice, this amount is not measurable and is also called the insensible loss. So here, if we add the amount of urine excreted as well as the insensible loss, then together it will balance the normal intake. However, if there is more loss due to the high temperature of the environment or of the patient's body, then the amount of urine output can also be expected to be less. Some 300 ml of water will also be excreted together with feces, which is not usually measured. So here, in case of diarrhea, significant amount of fluid will be lost with the stool, right? So for these patients, what we will be doing is we will be recording the frequency of defecation. So for these patients, we will be recording the frequency of defecation because this can also provide an indication of the bowel movement. So this is the physiological basis for the intake and output chart, where we have discussed that this chart is not only maintained in order to get an idea of the intake and output of a person, but through this we can also get an idea of the patient's physiology. And we have also discussed about the amount of fluid which one must consume, as well as the various ways which the fluid can be excreted from the body of the patient, so that we will be getting an idea whether the intake and the output of the patient is normal or not. So since I've said that maintenance of this intake and output chart is very important, however, if you encounter any patient with just minor cases, then maintenance of this may not be required. So for whom is this intake and output chart indicated? This is mainly indicated for those patients who is having a fluid and electrolyte imbalance, for kidney impairment patients, for patients under dialysis, as well as for patients with cases of burns, for patient who has just recently undergone any surgical procedure, for those patients with severe vomiting or diarrhea, for those taking diuretics or corticosteroids, for those who are having congestive heart failure, for those with cases of dehydration, of dark concentrated urine, excessive perspiration, if there is presence of any bleeding, if there is dry mucous membrane, as well as if there is decreased or little urine output. So these are the various patients who will require maintenance of the intake and the output chart. So now we have come to the end of this topic, whereby in today's session we have discussed about the intake and output record, where we have come to know why is it important, what are the purpose, what is the physiological basis, as well as for whom is this intake and output chart indicated. So I hope you have got a clear understanding of this topic. I'll be meeting you in another session where we will be discussing about the intake and output procedure. So until then, have a good day. Thank you. Good day. Thank you.